Bula and welcome to the launch of BES and the mSupply Foundation Strategic Partnership through the DFAT's Partnership for a Healthy Region initiative. Welcome, everyone. Thank you so much for joining this virtual launch. I am Safia Noor. I am from Beyond Essential Systems, joining from the Suva office here in the Fiji Islands. I have been with BES for 2 years, working on the National Supply Chain Reform Project. Your MC for the day. Before we dive into the content of today, I would like to share the highlights of the live launch that happened in Kiribati on Tuesday. Now we'd like to see a video of the live launch.
Welcome to this launch, and of course, welcome to the General Central Tropical Paradise, Prestigious Paradise, and welcome and thank you for coming to celebrate the launch of the BES and the mSupply Foundation Strategic Partnership with DFAT, which is made possible through the Partnership for a Healthy Region initiative. We are grateful that Kiribati is selected by the team as the hosting country for this launch. So this again put Kiribati on the digital map.
On behalf of BES and the mSupply Foundation, I'm really proud to announce the launch of our strategic partnership with DFAT's Global Health Division under the Partnerships for a Healthy Region initiative, which is DFAT's flagship investment in health in the Indo-Pacific region. Our partnership will see the continued development and implementation of free and open source digital health tools for the Pacific, including the electronic health record Tamanu, the data platform PHR, supply chain management system mSupply, and health procurement platform mSupply Hub. We're really proud to be launching this regional partnership here in Kiribati in the heart of the Pacific, and to be continuing and growing our collaboration with the Kiribati Ministry of Health and Medical Services on what will be some really transformative projects over the coming years. Here in Kiribati, we'll be working together with the Ministry to create an integrated and connected digital health ecosystem. We'll be expanding the electronic health record Tamanu at TCH to improve continuity of care and clinical outcomes for patients. In partnership with UNDP, we'll be expanding the PHR data platform, which is already being implemented in Kiribati as the National Health Surveillance and Performance Management System.
Very good morning to you all, Heaven and Melody. An essential component of any health system is health information system. And the partnership with DFAT and Beyond Essential on digital health has and will continue to transform availability and accuracy of health data and health information to inform and improve our planning, management, implementation, and monitoring of health services in Kiribati. We have the opportunity to continue building upon the foundation that has been laid to further expand and enhance digital health with the ultimate aim of contributing towards our new strategic plan vision of a healthy Kiribati. I wish to use this opportunity to thank DFAT for expanding the scope of its support of digital health development in Kiribati to now include support for a digital information system for our lab, digitalizing patient records at TCH, emergency department outpatient, and 7 TCH wards. As a small developing island state with limited access to resources and capacity, partnership plays an important role in improving the health of our people, especially women, children, and other disadvantaged groups within our society. As we look ahead towards the opportunity for creating change that lies before us, I wish to bestow upon us all our own Kiribati tradition blessings of the know, joy, and the double knowledge means health, peace, and prosperity to us all. I'm blessed on that. Thank you.
I cannot agree more on the importance of having easy access to accurate data to to informed decision making. And we are deeply grateful for the initiatives supported by DFAT to digitize our health data and records. The need for digital health information systems to improve management of health services is enormous. And I just want to highlight a few important ones. So the first opportunity that I see, we all know that ACD is responsible for high morbidity and mortality in Kiribati and the region as a whole. And we are keen, we just learned about the ACD digital information system used in Tamanu, and we're keen to have something that's adapted for our setting. Secondly, we know that cervical cancer is the second commonest cause of cancer in Kiribati, and we are now embarking on improving our screening program for cervical cancer. And so a registry for cervical cancer screening and case management is also important. Our last example, just to illustrate opportunities going forward, is our rheumatic heart disease registry.
Managing supply chain to ensure timely access to medicines, essential medicines, affordable medicines, but quality medicines in Kiribati is not easy. But this is an important role of the Kiribati pharmacy department. Amongst the challenges, the availability of an accurate or close to accurate data for medicine consumption is crucial to our work. Digital health systems play an essential role in managing health supply chains. They provide visibility of essential medicines at core health facility levels and streamline critical processes such as procurement, warehousing operations, and many more. Thanks to the Partnership for a Healthy Region initiative and additional support from the Kiribati DFAT host, we are happy to soon be starting a national health supply chain reform project with our colleagues at BES and at the mSupply Foundation, who we have a long-standing relationship with already. The digital systems are critical, but they are not the only thing that matters. And the National Health Supply Chain Reform Project will also help to support non-digital processes. We will work together with the BES and the mSupply Foundation to review the full health supply chain in Kiribati, identify the bottlenecks, and come up with solutions to address these barriers in a sustainable way.
Look, it's a very exciting day today. I'm excited because this is a really exciting launch, and what better place to do it than in Kiribati, in the very centre of the Pacific. The Partnership for a Healthy Region program is Australia's flagship program in health in the region, as has been described, and it's about $650 million. It's no small amount of money, and that's the money just flowing from DFAT through our Global Health Division into our Pacific neighbours. And we know that digital health is a priority for Kiribati. It's been quite clear that it is, and there's been a need for some time. Every health system can do with better digitalisation and better technology. Australia has been pleased to respond, and through this regional program, through the Partnerships for a Healthy Region, as well as through additional support being directed from the High Commission side through our budget, that we are able to launch today this excellent partnership, which, as I say, is a partnership for the region, not just for Kiribati, but it's starting here, and importantly is starting here. And then it's going to go and also be able to grow in scope. And I thank the OIC for explaining just before the additional elements that we're able to tack on, for want of a better word, to broaden the scope of that digitalisation. So allow me to conclude just by saying thank you all for being here today. Thank you to the Ministry for hosting. We appreciate your collaboration as always, and to the team for setting it up. We look forward to working collaboratively with you moving forward in the implementation of these new digital health initiatives. So thank you very much for your time.
So on 3, 2, 1. Yay. Thank you everyone. Thank you for being here.
All enjoyed that video. Now let's go back to our slide. So basically, I would also like to take this time to thank DFAT for funding this, and at the same time, thanking the project owner, that is Kate Nope, for this, and on top of that, all the other DFAT staff that has joined this launch virtually. Emphasizing on the note that was spoken by Dr. Kiribati in the video was program registries is now a priority for all countries. And I'm taking this to plug again the fact that we will be doing a webinar on July 11th on this particular subject. Now moving on. Introduction to our strategic partnership would be done by Georgia Mulenga. She is our Beyond Essential Systems project manager for Tupaya, joining all the way from Apia, Samoa. It was a pleasure to introduce her. Thank you.
Hi, everyone. My name is Georgia, as Safia has already introduced me. And I'm going to run through a little bit about our strategic partnership with DFAT and what that means for our country partners as well. So to start off with, a little bit about Beyond Essential Systems, or BES. So we are an Australian organisation and we're focused on the development and implementation of health solutions. We have offices in Melbourne, Auckland, Suva, and also a few of our project staff are based across different Pacific Island countries. The key software that we develop in-house is called Tupaya and Tamanu, but we also implement mSupply, DHIS2, and Senite, which is a laboratory information management system. We also work not just in software development, but we provide consulting on health supply chain reform, things like information systems and data, as well as geospatial data for decision making. So I'm going to move on to a bit about the mSupply Foundation. So the mSupply Foundation, also known as TMF, are a not-for-profit organisation that have offices in Auckland, as well as Kathmandu, Nepal. So mSupply software has been implemented in over 40 countries and is the most widely used LIMS system for health supply chain in low and middle income countries and settings. So TMF was previously Sustainable Solutions, and they've partnered virtually with every major donor in the world for their project implementation. So now a little bit about what we do. So between mSupply Foundation and Beyond Essential Systems, we do activities such as software development, software implementation, including support desks, supply chain and clinical workflow strengthening, data collection, aggregation analysis, visualization, and data for decision making, digital health capacity strengthening, including IT support. And between the two of us, we work in 14 Pacific Island countries, as well as Laos, Myanmar, Cambodia, and elsewhere. So now what we've all come here today for, and that is our partnerships for a healthy region. What is it and what does it mean? So this is Australia's flagship investment in health across the Indo-Pacific region and amounts to about $620 million across 5 years. So that's taking us from 2023 through to 2027. I will just note as well that between BES and mSupply, we're not getting that full 620 million, but that brings us to our next slide, which is talking a little bit about our strategic partnerships and the different organisations that have been given these strategic partnerships. So you can see on here that BES and mSupply are a strategic partner of Australia's Department of Foreign Affairs and Trade. And you can also see there that we're in quite good company with some other very wonderful organisations that I'm sure are familiar to everyone on there. One of the partners that I wanted to highlight as well today is FISH. So DFAT is supporting other digital health and data initiatives under the Partnership for a Healthy Region. So one of these is the Pacific Island Information Support Hub, also known as FISH. And whilst the funding model is slightly different to ours, since the Australian Institute of Health and Welfare is a public sector agency, Our aims are closely aligned with FISH, and we're already working together with them to ensure coordination across our activities. We don't want to be doubling up on anything. So FISH is focused on supporting Pacific Island countries and territories to strengthen their health information systems and improve their ability to collect, validate, analyse and disseminate health data to inform health policy. We didn't quite leave enough time today for FISH to present, but it would be a disservice to make them have to squeeze it in or rush that kind of presentation. So we've actually planned for them to have a complete presentation, including with a Q&A at one of our upcoming webinars, which I'm sure Safia will plug again later this afternoon. So digital health tools support progress towards the SDGs on health through things like service delivery, clinical care and data for decision making. Importantly, and this is sort of on that last point there, countries in the region are telling us that this is what they want. We've seen a lot of countries that we work with have been prioritising digitisation of their health systems in their policies and making it a policy priority for their country. So in terms of our strategic partnership design, this is a pretty big and hefty slide, so I don't expect everyone to read through it all, but this just gives you an idea of what our sort of 4 pillars are that we're working towards over the next 5 years in the region. So number 1 is our clinical care software. Number 2 is health supply chain software. Number 3 is our health supply chain capacity building and strengthening. And number 4 is our public health and sustainability work. I'm going to go into a little bit about what is covered and maybe what's more importantly, what's not covered. So to start with, what is covered by the PHR, this is things like software development and the maintenance of our software. So that includes Tamanu, Tupaya, Open mSupply and Health Supply Hub. Also the setting up of our support desk in Suva in Fiji. It includes data stewardship and data for decision making, the expansion of our DTAC program, and the coordination activities with our other partners as well. But what's not covered as part of our PHR? And this is probably what people may be more interested in. So what's not covered? Any new project implementation that might happen. So this would include travel time or staff time, SLAs or service level agreements that we may have with countries, as well as any major software customizations that are pretty bespoke or specific to your country and your implementation. So if you do want these things that are not covered, that's where we come into our bilateral funding plugins, as we're calling them. So you can see there in the middle, we have our PHR core investment, and that's what we're launching today. And this is regional funding for the whole region. We then have what's called our bilateral funding plugins, and that's what you can see around the outside of our green core investment. And so our bilateral funding is added on from our DFAT country posts, which is Australian funding that's dedicated for specific use for that country. So for example, Nauru has a bilateral funding agreement, and so we have some funding there to be able to do some specific work for Nauru. It's important to also note these are 5 sort of plugins that we have so far, but at any point in time, a new plugin can be added on to our PHR core investment. So a little bit about our software and our ecosystem. I think this slide has a love-hate relationship within BES, but I think the idea is that software and implementation of it is a bit of a complicated beast, and there's a lot that goes into it. The software that you can see on the screen is software that helps for us to achieve those 4 pillars that we were talking about before. So it covers our health system to be able to implement and provide patient care and to be able to track all of that digitally, to improve our supply chains, and also to strengthen reporting and data for decision making. So I feel like that was a lot of information, and unfortunately we don't have any time for Q&A today. But in summary, BES is a health software provider for the Pacific. The mSupply Foundation develop and implement mSupply's suite of products, and we're partnering with them jointly for our to be a strategic partner of DFAT. And finally, we have our separate bilateral funding plugins, which can be added at any time. That's all from me, and I'm going to hand back over to Safia to take us to our next part of the presentation.
Thank you, Georgia. Now, welcoming our next speaker for the launch is Edwin Monkfont. Basically, he is the head of engineering for Beyond Essential Systems, joining all the way from Auckland, New Zealand. He will be talking about the launch of Tamanu 2.0. It has been a great pleasure to introduce you. Over to Edwin.
Thank you so much, Safia, and hello, everybody. I'm really happy to be here because I started my career and work in the Pacific at mSupply, now called the mSupply Foundation, and now obviously work for BES. So this partnership is a very nice marriage for me. So just to give a bit of a background of Tamanu, we started out in 2017 by looking for an electronic medical record that we could use in this context of Pacific Island settings, other low and middle income countries, that would really meet all of those needs. And we couldn't find one. We couldn't find one that met all of the needs that we thought were there. So we decided to build our own. And that's been a big piece of work starting in 2018. But we did get it into production in 2020, and that was just in time for a lot of need. There was a lot of demand, obviously, for this sort of tool throughout the pandemic. And it's only gone from strength to strength from there through, I guess, a lot of that pressure applied, from pressure comes diamonds. And so we had to do a lot to get through that pandemic phase, and we've continued to invest in that product. And now in 2024, we've released Tamanu version 2.0. So from that version 1 that we were using in the past, we've made huge improvements in scalability, functionality, usability, and in security. Safia, next slide. So why did we start out to build it? I said that there were some needs that we couldn't find met, and it was because all 5 of these principles that we were looking for, we couldn't find another software that could do them. So first of all, obviously, you all know the context that we all work in, which is that the internet is not always available. So having the software work 100% of the time with all functionality when the internet is down was really important. Another thing is that it's free and open source, so there's no ongoing license fee lock-ins, and that you don't have any specific vendor that you're tied to as a country. Had to work on both desktop and mobile. We know that mobile use case is really well utilized and is needed for some of the smaller facilities as well as clinical touring. We obviously, with any public health software or any health software at all, need to have really high levels of security to keep that private patient health information really well protected. And lastly, it needs to be interoperable and have integrations with some of the standard software that is used around the Pacific, like DHIS2 and like mSupply. So what we built was something that met all of those principles and also was in general a full service patient electronic health record. We've built it in the last 5 years, and so that means it's built on modern and cutting edge tools. And I'm happy to say that we made some really good decisions early on, and the tools that we've decided to use have only become more widespread and more adopted. And so we were onto a good thing from the start with the tech stack that we built on top of. It's also very intuitive. We've really tried to focus on an emphasis on good design that makes it easy to use and also enjoyable to use. It's very low cost, so the licenses are completely free. We don't charge anything for them. There is obviously implementation costs and the optional support and maintenance costs that are ongoing. But because we operate as an organization that cares about the sustainability and success of these projects, and we actually care about the health systems in the countries we work with, it's done at close to cost, which means that it's a lot cheaper than if you go with an international vendor, traditional commercial model. The other thing is that the data exchange with external services in the eHealth ecosystem are all done using HL75, which is a really internationally supported global standard and the most modern and current global standard. And you can use Tamanu for all of tertiary care, public health, small clinics, outreach teams, surveying. You can use it for many, many different use cases, all within the one platform. Thank you. So in Tamanu 2.0, we made, as I said before, huge advances. So that HL7 Fire standard, that is the most current and becoming the most adopted new international standard for data exchange, is default across our integrations. And we've built several integrations, which I'll speak to later. Our new sync engine, we put 9 months of dedicated engineering effort into, because synchronizing data so that the data that's recorded offline is available across all of a country's health system. We invested all of that time to make that more reliable, robust, scalable, and fast. And that's been the case, and we're really happy with the outcomes there. We've increased the granularity of our permissions model. We've improved the reporting, including the ability for countries and IT staff and data analysts to create their own reports against an additional reporting schema, which makes it more, which makes it faster and easier to run custom reports against. The functionality we've just expanded massively. We actually have a release of Tamanu every 2 weeks, and with each release comes new functionality. And we have made it so that rather than using a more specific open source license, we've gone for the standard GPL 3.0 license, which is one that's very well understood and recognized and very permissive. So the whole of Tamanu is now very standard type of open source. And the potentially biggest one from the user perspective is that it now runs through your browser. So through Chrome, you can install it as a progressive web app so that it'll show up on your desktop and run in its own application. But you can use it through the browser, and that means that you can use it across PC, Mac, and Linux, and it will work the same on each. There's much lower overhead when trying to install and upgrade, and all of the same levels of offline functionality are still supported in exactly the same ways as before. Thanks, Safia. I'm not going to go through all of the features because I'm churning through my 10 minutes of time here, but needless to say, there's a lot of features that we've built out and added during Tamanu 2.0 and built upon as well from the version 1 features. Next slide. Just briefly on the architecture, because this will bore most people, we have a multi-server distributed architecture, which means that there's a central server, and that is the one that is the kind of the main database that has all data for all the country, and it orchestrates and controls the data exchange between all of our offline Tamanu clients. So those are the facility server, which is top right, and that can support a bunch of different desktop or web apps that people are logging into within a facility, and also all of the mobile clients down the bottom left. Those all synchronize through the central server. And then we have our external services as well, which is via the API integrations with HL7 Fire as the standard. Thanks, Safia. Security, we have always had a strong emphasis on and only improved on. So again, this is quite a few things that I won't go through for the sake of time, but the permissions model is the biggest one that is different in version 2.0. We've really made that much more granular. You now have 4 different verbs across each resource in Tamanu, so that you can specifically control whether one person is able to just view or can edit, for example, lab requests, and that can be different to whether they can only list the imaging requests that have been made, for example. Next slide. With data, we've also really improved the ability to import and export data. Sorry, if you can just go back one. And make it so that it's more self-service for end users of Tamanu to be able to do those imports and exports of data. But we've also built out better integrations with our Tupaya mapping platform and data aggregation and visualization platform, as well as being able to, as I said before, create those custom reports within Tamanu. So that can now be done through a front-end interface. There's also, let's go over to the next slide. There's also some specific ways that we present data in more intuitive formats. So for example, this ED or emergency patient listing, which has those color-coded levels that have been triaged, as well as giving you some statistics about the wait time and other things like that. Next slide. So the integrations has been a huge thing that we've been working on. Integrations, as Georgia indicated earlier, can be challenging, but we have relied on HL7 FHIR, this international standard, to make those so that the more that we support that standard, the more that any other service that supports that standard can be integrated with Tamanu. We've already proven that that is the case with RIS-PACS, which is imaging, LIMS, so laboratory software, vaccination registry, billing, which actually uses a non-HL7 FHIR API, and of course, mSupply for your medical inventory, for medicine stock taking and everything like that. This is the HL7 FHIR levels of implementation. And so we are working through those layers of the HL7 standard, and we've already completed certainly the first 3 and most of 4, and we're continuing to work on some of the clinical reasoning things, some of the stuff around decision support. Support and maintenance is also something that is, as a sort of parallel workload, we've been working on improving alongside the software being improved. And our biggest thing there is moving our support desk to be a fully supported, dedicated support desk, which is available 7 days a week and based in Suva. And so we have both the Suva office, who are the first port of call for support, and we have a standard set of emails that people can contact on. We have multi-channel support, so you can send Viber and WhatsApp messages, and then if those support staff need to escalate it, they can escalate it to on-call technical staff in Auckland and Melbourne. I think that might be the last slide. Let's just check if there's more slides there, Sophia. I think we have one slide of, there we go. Thanks for that. So if there's any questions, we don't have time now, but please do email through.
Thank you, Admin. Now let's introduce our final speaker for the day, Jessica Yakov. She will be talking about the launch of Health Supply Hub. She is from mSupply Foundation, and she is currently joining us from Canberra, Australia. Over to you, Jessica. It was a pleasure introducing you.
Thanks, Safia. And hello, everyone. First of all, thank you to our BES colleagues for the great introduction, and us at the mSupply Foundation are very much looking forward to working with BES over the next couple of years as a strategic partner for DFAT. So I'm really excited today to be able to share some information about the mSupply Foundation's new centralized procurement portal, which is Health Supply Hub, which, thanks to the funding provided through the DFAT Partnerships for a Healthy Region, we'll be able to continue to build and improve on the platform over the coming years. So Health Supply Hub is a cloud-based centralized procurement platform that integrates with mSupply, our logistics management software, to streamline the procurement of medical products throughout the whole procurement process, all the way from tender planning to evaluation and award. Now, we know within the Indo-Pacific region, and particularly in the Pacific, there are a lot of commonalities that we can leverage when it comes to addressing shared procurement issues and strengthening procurement activities at a regional level. Within the region, just having a think, we have a lot of common suppliers that actually supply our country's medical products. So this is one reason why we've gone with a centralized portal, to ensure that suppliers have one place that they can access a lot of procurement activities that the countries are sending out. The second part is that, as noted, the majority of countries, particularly in the Pacific, are using mSupply to manage their medical product inventory and logistics. So having a system that's compatible and can send information back and forth between the systems is definitely a benefit in automating and reducing manual entry. Now, With the initial version of mSupply of Health Supply Hub, it's already in use by more than 6 countries in the region, just including some Fiji, Vanuatu, and Kiribati. And again, and thanks to support from DFAT, we're really looking forward to continuing to develop and implement new features over the coming years that can be utilised for further regional benefit as well. So now let's delve into the Health Supply Hub workflow to see how it integrates with mSupply to digitise and streamline the procurement processes. The first step is in the planning and preparation of the tender. Staff are able to use mSupply to conduct critical tender preparation tasks, including performing a stock take to verify inventory records, run reports to assist in product selection and quantification. Following this, procurement teams enter detailed information and criteria into the tender module, including things like submission deadlines, required quantities, and suppliers for invitation. Now, once all of this information is finalised, it can then be published up to Health Supply Hub. The integration between mSupply and Health Supply Hub ensures that all of that critical tender details are available on the Health Supply Hub portal for both procurement team oversight and for suppliers to access. Now we get to the second step, the tender advertisement stage. Health Supply Hub has a range of features for both the purchasing organisation to manage this stage of the procurement process, but most importantly provides suppliers with a portal to review and submit quotation responses for tenders. Once invited, Health Supply Hub allows suppliers to navigate through the tender requirements and submit their corresponding bids and upload all necessary documentation. Simultaneously, procurement teams can monitor the engagement of a tender through Health Supply Hub in being able to see which suppliers have indicated an intention to bid or when they've submitted their bid for evaluation. Now, once the deadline has passed, the bids can then be downloaded back into mSupply through an automatic process, allowing for all that critical data to sync, so that bid information back into the mSupply tender module for evaluation, which is our third step. Procurement teams use the mSupply tender module to evaluate the received bids. Key bid information is populated from suppliers into Health Supply Hub, such as costs, delivery timeframes, and expiration dates of products. The use of an integrated system in receiving all this data in a standardized format allows for the evaluation process to begin and proceed really smoothly and efficiently. So overall, by integrating Health Supply Hub with mSupply, we've been able to create a seamless workflow from beginning to end that ensures the entire process from tender creation to award is efficient, transparent, centralizes all data in one place, and fosters better informed decision-making. So now we've gone a little bit over the workflow. We're going to jump to the next slide and take a look at some of the features to promote the features including in Health Supply Hub right now. Now, Health Supply Hub has been designed with features to promote procurement best practice, such as transparency and efficiency in all procurement practices. Some of the features we've created to automate cumbersome manual processes, such as the ability to set supplier lists for preferred or pre-qualified suppliers, particularly around certain product types where there might be specialized suppliers. The automation of emails is another key example. The system is able to send automated emails to all invited suppliers at key milestones of the procurement process. So just another thing off the plate of our already busy and overburdened teams often managing procurement. The last one is document management features to store and organize files for easy access up in the cloud-based system, also removing some of the data storage concerns that countries might have and removing the need for documents to be mailed to a file location. Other features have a focus on ensuring probity in our procurement systems, including providing auditable trails, overview reporting panels that can be shared with management, and a lot of communication features such as notices and Q&A to ensure that everything is transparently communicated to all suppliers throughout the procurement process. Now, these features bring in a lot of benefits in managing efficient procurement process. I'll briefly touch on some of the benefits in the next slide. Now, one of the key benefits is obviously to enhance efficiency and quality of procurement processes. So having the automation of data coming through mSupply up into Health Supply Hub obviously reduces the amount of time and data entry that staff will have to do in setting up and advertising tenders. We've also seen for countries using Health Supply Hub a large decrease in the total time of tender from creation all the way to awarding, particularly in receiving timely responses through Health Supply Hub from suppliers. One of the other key benefits is improving the transparency of procurement. Having a centralized platform that tracks everything, all the way from mSupply to users that are making changes to which items and the quantity that they would like, all the way down to which suppliers and their staff are interacting with the platform, allows for better governance. And also when we're looking back at the procurement and able to demonstrate whether there was value for money in our decision making and procurement decisions. So that's a massive benefit when we might need to look back and see why a particular product was ordered over another one. A big last benefit I'll just touch on is simplifying the process for suppliers. Now, as I mentioned, we have a lot of common suppliers in the region. Suppliers are also going to benefit from having a single centralized portal to manage their bids across the multiple countries that are sending them. Now, instead of dealing with different systems and different procedures and having manual documents being sent out, having a standardized bid format starts to mean that we can have an improved quality of bid information coming through, and suppliers know how to quickly respond to information through Health Supply Hub to make sure that countries can order products quickly, and then also hopefully remove the need for urgent ordering in the future by making procurement cycles more efficient and reducing likelihood of stockouts. Now, all of these features together, we hope will end in better outcomes and reduce risk and greater savings for procurement activities. In practice, we've seen large savings for countries that are using the mSupply tender module in combination, especially with the remote Health Supply Hub portal, in the amount of millions by allowing for product bids to be evaluated on that line-by-line evaluation basis. Now, I'm going to stop talking. I'm going to pass on to a small interview with Kiribati's Chief Pharmacist, Moanara, who's going to outline her experience using Health Supply Hub.
My name is Moanara Benedict. I'm the Chief Pharmacist at the Kiribati Ministry of Health. We've been using Health Supply Hub since last year, 2023. It cuts down the time of the tendering. Advertising is a big challenge to us and our team, because we need to send out invitations and advertisements over the emails to one supplier after another. And with this Health Supply Hub, it's just you uploaded all the documents at once and push on one click. It just sends all the invitation to all of them, so you don't need to send multiple emails. Well, I think what I can share with this is how the senior leadership team in the Ministry of Health are amazed by this Health Supply Hub. They also have their own logins. They follow where the status of the tenders that we put out, and so we don't need to update the management team every now and then, because they just log in and see where we are. And as I said, it will save a lot of your time, and also I think it's a great tool to use. It has other it also provides other guidance that you need to follow. So I think I would advise that you also introduce this Health Supply Hub to the Central Procurement Unit through your Ministry of Finance. They also need to understand how to use it. And this was what we did last year. We introduced this system and the advantages of this system. And we also have the team from the Central Procurement Unit users. They also have their login users, so they can also follow what we do on the Health Supply Hub for transparency purposes. From our perspective, it also exposed us to other suppliers that we didn't know that exist, that other countries are using. I think this is we get from other countries, because they provided which supplier are they using, and that's when we get to know the other suppliers as well. So this is one of the benefits of sharing this platform in the region. It's a special thanks. I think with the support, we still need a continuing support from BES. This is the first time we get the tender out, and we also used it for RFQ. The first RFQ that we sent out in March, which BES also support us with. But we still need a continuing support on this until we get our, our team use it as experts. So thank you.
Now this brings us to the end of the launch for today. The final 3 points to go home with would be how thankful we are for DFAT to fund us for this particular initiative. And at the same time, we are very thankful to all the users that have joined us from the various countries. And at the same time, we are thankful for everyone who have presented today. Secondly, please join us for our upcoming events. As you all know, the Pacific Drinks. Secondly, the program registries webinar, which is starting on 11 July 2024. Now, the video of this particular launch would be available on our websites and as well as our socials. Vinaka Vakalevu from BS Essentials and TMF. Thank you.